Meeting of the Mohave County Board of Health will come to order. We start with a roll call. Pledge of Allegiance. Okay.
Roll call: Frank Labarge.
Present.
Donna Williamson.
Present.
Dr. Richard Hendricks.
Present.
Maggie Wilcox.
Present.
Margaret Nyberg.
Present.
Kathy Bruck.
Present.
Terry Williams.
Present.
And Joy Brotherton, Larry Carver, and Dr. Dat Wynn are not present.
Have we all had an opportunity to review the minutes from last meeting? Are there any changes to be made to it? Okay. May I have a motion to approve the minutes then?
So moved.
Second.
Aye.
Minutes are approved. We have a community health profile assessment.
I am pleased to introduce to you tonight Susan Williams from the Health Department. She works in our chronic disease prevention and tobacco prevention programs. She's a supervisor there, and Terry Williams from KRMC. About 2 years ago, we met with KRMC and discovered that nonprofit hospitals are required to do a county-wide health assessment, and health departments nationwide are required to do one if they want to be accredited at some point, which is a brand new process for public health. And so we decided to partner on it. It was silly for two different entities to do a study like this, and partnering would allow us to have a comprehensive one and a partnership that we hope will continue over the years, because we intend to follow this through every 4 to 5 years and do another one and see where we're going and where we've come from. So I'm very pleased tonight to have them both. They spearheaded this project. It took hours of time, and I honestly don't know how they did it on top of their other jobs, because this was not their normal day job. So I'm very pleased to introduce both of them tonight. Terry, as you can see, is a member of the Board of Health, but she's going to do part of the presentation tonight and give you a comprehensive view of what our health looks like for Mohave County.
Thank you, Patty. Good evening. Like Patty said, this was a collaborative effort between the hospital and the health department. And we are the only collaboration throughout the state that is working at the local level with a nonprofit hospital. So they look to us to do this throughout the state with other hospitals, the other non-profit hospitals. Not only did the hospital and the health department spearhead this effort, we also engaged community members. We went to key stakeholders, leaders, and community members to get their input and backing to start this process. And how it started was we applied for a grant through the National Association of County and City Officials to get funding to do this process, this community health assessment. We were in competition with over 200 other agencies throughout the country, and we were not successful in getting that grant. However, the momentum across our county, everybody wanted a community health assessment. They were on board to be a willing partner to get this done. So we capitalized on that momentum and moved forward. We named it the Community Health Improvement Initiative. And like we said, it's an ongoing process to improve the health and the quality of life in Mohave County. And how we were going to accomplish this was first to do a community health assessment, and then look at those findings and produce a community health improvement plan. And this just wasn't going to happen once. We will be doing this every 3 years. So we were on board and committed to do this process. So the health assessment is a way to collect data and analyze it. We looked at local, state, and national statistics. We did in-depth interviews with key stakeholders and leaders. And then we surveyed the county. And then finally, we wrote a report, and that report is called the Community Health Profile, which is currently on the Mohave County website and likewise KRMC. Moving forward with that Community Health Improvement Plan, we're just engaging in this now. This is going to be an action-oriented process based on those findings in that health profile. We're looking to prioritize the health concerns, develop strategies to measure outcomes, and then to implement programs. And specific to each community, we're looking, the 3 major communities that we're in is Bullhead, Lake Havasu, and Kingman. But we didn't leave out those outlying areas. We did capture data in the report that you all have. So, but currently we're just engaging in workforces in the 3 larger communities. And as Patty said, we're doing this because we weren't going to work in silos. It was the timing that the hospital and the health department could collaborate. We've been working together with myself with the tobacco education and chronic disease since the inception of that tax funding. So it's been many years, but this was to broaden it out into our communities and really make a difference here. The hospital seeing the indicators of people coming through their emergency rooms, the diseases that they're tackling in the hospital, chronic diseases. And us as a county, we're not a healthy county. We top the charts, not in a good way, with cardiovascular disease, lung disease. And you're going to see this as we move forward in this presentation. So again, we just capitalized on this opportunity to work together. And also, it's a way to be accountable to each other to make sure that this was actually going to happen. And so the timeline, we wrote the grant, we submitted it in May of 2011. And I'm going to take you through this walk because this is not something that just happened. This has been almost 2.5 years in the making. Then we got, later on in August, we got grant funding from the Arizona Department of Health Services. And then we got free technical assistance from the Rural Health Office down in, out of the University of Arizona. Then we brought all the stakeholders together. We had over 50 stakeholders that came for a meeting, and we told them what we'd like to do, and were they on board for this process? And they were. So we moved forward. We started collecting data, as we talked about, over the next year. We had a MPH student from the University of Las Vegas that did her internship with us, so we capitalized on getting that knowledge for free. Then we held our first stakeholders meeting in Lake Havasu, and we had about 35 participants. We wanted to bring it to the local level so that we had the city and the community involvement as we move forward. Then we hired a consultant with that money to help us with that data collection. We then went to the stakeholders in Bullhead City, And then when it was about a year and a half, close to 2, we needed to bring everybody together to just inform them that we were still a group, we were still moving forward, and what we had accomplished. And then the surveying began. We did in-person interviews with the key stakeholders. We then did paper surveys with the community stakeholders, identified like superintendents of schools, the college dean, CEOs of the hospitals, so on and so forth with there. And then we did 1,752 community-wide surveys. And those surveys went out paper through the library. They could actually get a paper copy, or they were done online. And we did media presentations through all the media outlets. We did, it was on the county website and the hospital. And that was a really good number of surveys to get back. Again, in mid-2012, we completed the draft survey of the community health assessment, and we completed it, and then we brought the groups back together again to do a presentation on what was in that assessment, and then the groups decided as a city which concerns or health priorities they were going to do something about and take ownership. So, and then another thing, one of the key indicators that came out was substance abuse, and that our youth are at risk. And so we collaborated with the State Office of Children and Families through the Governor's Office, and they came to each one of our cities and did a presentation. It was a 3-hour to 4-hour community mobilization presentation on youth risks, behaviors, and protective factors. And they are collecting data at the state level for each of our communities, so they shared that with us too. So, with that, I think Terry and I are going to go back and forth just so you don't get bored with my voice the whole time.
So Susan and I aren't sisters, okay? No, Williams is such a rare name. Anyway, couple things about this report that I'd like to point out. First of all, this is the first time ever that there has been a study of community health done at a local level here in Mohave County. And so it's pretty revealing. Certainly a lot of the data that we got were from CDC, a lot of national data who's collecting it, some from the state. But so there's a lot of it that's real cursory, way overhead. You know, some of it that you kind of look at it and go, really? I kind of wonder, as we go through this whole community improvement process, or health improvement process, we are going to, our aim is to drill down and really, if we need more data, if we need to collect more data, then we're going to be doing that. So anyway, I would like to kind of go over a few of the statistical findings in the report. As you can see, we'd be here all night if we went through all of them. So we'll go through some of the key things. First, we collected a lot of demographic data. Most of it was from the 2010 census, but again, that kind of lays the groundwork, and part of the purpose of this data is for tons of different organizations in the throughout the county. This is really key for grant writing, fundraising, that sort of thing. So having all this data in the same place, and of course it has major bearing on community health. So as we go through this, you can kind of see how this builds. First, First, of course, we have a lot of the population density. Pretty interesting to compare population density both in the U.S. along with the state. We have 14.96 people per square mile, where Arizona is 54.99 people per square mile. So very low density in our population per land area. Our population growth has grown and pretty well about the same as Arizona. And I think, hold on. It isn't, we don't have the slide here, but if you look in the report, you'll also see projected growth statistics in that report. So those are there. The median age is really interesting. The median age, we all know it, Mohave County is 46.30. And when we say median age, we're saying how many people below a certain age and how many people above a certain age, and then they calculate the median age. So 46.3, the median age is 46 years old, where Arizona it's 35.5. So we have, this tells us we have a older population, and when we look at health needs in our community, that has a lot of bearing on what we need to be looking at in terms of services and support for senior citizens. Education indicators are huge. There's all kinds of data that say that the lower educated a person is, the unhealthier they are. People with higher educations tend to not only have better jobs, that gives them more leisure, less stress, they eat better, they have an understanding of their own personal health. Our education indicators are very, not real good compared to the state. You'll see that we have a 17.04% of our population without a high school diploma. And our graduation rate, our 4-year graduation rate, what they look at is from the time a student enters from freshman and graduate on time within 4 years. And our graduation rate, our 4-year, is very low compared to the state and the nation. Educational attainment is pretty stark. If you look at those completing high school, 83.9%, which is about not too much lower than the state. However, those with a bachelor's degree or more, only 12.2% in Mohave County, as compared to 26.4% in the state. Median household income is also a very huge indicator on health and health needs. As we all know, it's only common sense, but if you can't afford insurance, if you can't afford preventive care, as well as just proper food and whatever, really has a huge impact on health. And so Mohave County's median household income is $32,000 a year versus Arizona at 44, and you can see broken down by cities where that is. Economic conditions, so high unemployment. Let's see, what do we have here? Is this the unemployment rate? Okay. So the unemployment rate, as we know, it shows that it dropped from 2011 to 2012. However, The unemployment rate only counts people who are filing for unemployment insurance or whatever. So, we suspect that the numbers for unemployment are quite a bit higher than what these statistics show through the U.S. Department of Labor. But again, a lot of unemployed. It was interesting, as in our surveys, we had a place where people could comment. It was very interesting how many people commented in the survey that they've been laid off from a job and now have no way to get health insurance. And people would say, I'm sick, and what do I do? I've been laid off. And so, we have a tendency to say, well, get a job, but however, the economic conditions are pretty rough right now in the county. We looked at the population below 200% of the poverty level. Also in the report, we have population below 100% of the poverty level, which is what we say are the poor, below 100%. However, a lot of programs and qualification for programs, state and federal programs for assistance or whatever, 200% is a kind of a cutoff level for receiving a lot of subsidies programs. So anyway, if you look at Mohave County's population below the 200% poverty level is 39.77%. Not a whole lot higher than Arizona in the United States, but still higher. This number is, I think, terrible. Children living in poverty. Okay, remember that median age that we had, where we have a higher senior population. So that's, all these people are counted in the poverty level, but when we look at the number of children in poverty, it's pretty stark. 24.6, almost a quarter of our children in this county are in poverty. Not good. Children that qualify for free or reduced price lunch in Mohave County, 56% qualify for free or for those programs. We also looked at food stamp recipients, and Mohave County is 20% of Mohave County's population are on food stamps. Population receiving Medicaid. Now, these numbers are kind of skewed because if you look at, this is from Census Bureau 2008 through 2010. So some of these numbers were before the state cut childless adults out of the access program. So it's showing here 24.13% of the population was on or qualified for Medicaid. I assume that is that they receive Medicaid, yes. So 24.13, I assume that the reality is, as it stands right now, without Medicaid expansion, once Medicaid expansion comes in, it'll probably come up to this number. I assume this is lower right now, that there's fewer people on Medicaid. And we see a lot of that in the hospital setting and some of our programs. Access to care. So one of the huge things we were looking at is how well do people have access? What are the barriers that prevent them from accessing proper health care? And it's a huge range. It can be everything from being in a remote rural area and there's no doctors in your area to, so you don't have access, to maybe people are homebound and can't get out of their houses, as well as financial issues. They don't have insurance. They don't have a way to get to proper medical care. And when we say proper medical care, we're also looking a lot at preventive care. Are they getting their immunizations? Are they controlling their diabetes? That sort of thing. So access to primary care is a huge indicator because it really does weigh on if people don't have access to primary care, they're just not going to be as healthy. So as you can see, over, let's see, 49.9 let me look at that. Oh, it is the rate, sorry. So this is the number of primary care providers per population. And so per 100,000 population, we have 49.9. There's just not enough primary care providers for the population. And we've seen that again. A lot of this data is reinforced with what we saw in the survey results. A lot of people saying long wait times to get in to see a primary care provider. Hard to get an appointment, whatever, because what primary care providers we do have are booked, solid. So that's a difficulty. And as you can see, the state average is 70.7 is the rate for number of primary care providers per 100,000 population. We also looked at health professional shortage area. We looked at, and this is a national statistic that the U.S. Health and Resources and Services Administration, in fact, I personally use this number a lot when I'm writing for grants, and 70.95% of our population is in a designated health professional shortage area. That's a federal designation. So a lot of our population is designated with that designation. It just means that they just don't have access to proper, not only primary care, dental care, and certainly mental health care, and we'll get into that quite a bit later. Federally qualified health centers, if you're not aware of what that is, these are health centers that are designated to provide sliding scale fee services, primary care services, and they're supplemented by federal funds. And so they receive funds to do that. North Country Healthcare here in, well, I think they've got offices in Bullhead, Havasu, and here in Kingman. And so we do have 3 federally qualified health centers, not near enough for the need that's out there. There is one other that is in the northern Mohave County in the Colorado Strip area, I think in Beaver, and the name of it escapes me. What is it? Canyonlands, okay. We looked at one part of the assessment, and this was we actually had a committee to just do a survey of all the health resources that are available in the community. So we looked at everything from acute care hospitals to primary care physicians, dentists, and mental health providers. And so we have kind of a survey, if you will, of what health resources are here. Okay, I'm going to go into some of the health indicators. As Susan said, probably in about every health indicator, it's not good news for Mohave County. And there were very few that our rates and aren't worse than the state and the nation. So anyway, we looked at when we looked at health indicators, there's 2 ways of looking at. We look at morbidity, which is an age-adjusted incidence of a given chronic disease, and death from that. Okay, or I'm sorry, no, incidence of the disease. Mortality, of course, is death from a disease or, and in some cases, accident or whatever. So, and we also looked at premature death, and that's our next slide. It's horrible. And so this is a real important number and something to kind of pay attention to, because back to that median age thing, a lot of people will say, because our mortality, because we have such an aging population, our mortality numbers are going to be high, our chronic disease numbers are going to be high. Yes, it's true. It definitely is going to impact those numbers. However, this premature death numbers are a real indicator to show that we got a lot of people dying younger than they should, and from chronic diseases. And the way this indicator works is that it looks at from the age of 70, from the time, if a person dies at 65, they subtract that 5 years. And so from all the deaths in Mohave County, and the citation isn't on there, I can't remember what year, this is from, I assume, 2010. Almost, if you look at that, the years of life lost is 10,374, which is our rate per the population. So it's balanced. So if you look at that compared to Arizona in the United States, it's very, very high, very high. So when we start looking at some of these chronic disease indicators and death, mortality numbers, we need to kind of think about that a lot of these are in younger people, and we have some reasons why that is revealed in this report. Certainly, like anywhere in the world, cardiovascular disease is the highest cause of death. And then second, of course, is cancer. Malignant neoplasm is another word for cancer. Where our third one, though, is not typical of Arizona or the nation. Usually there's cardiovascular disease, cancer, but COPD is huge. And we have some really startling numbers having to do with COPD. And then you can see, and I'll show you accidents, Alzheimer's, chronic liver disease, and cirrhosis. We looked at local causes of death and compared with cardiovascular disease, lung cancer, breast cancer, motor vehicle accidents, and you can see the comparisons between cities. And most of these for our population are really high and compared to the state. Heart disease, stroke, and cancer are, and actually within this report, we put cardiovascular disease, we kind of grouped heart disease and stroke together under cardiovascular disease. Other high rates of death in the county, our motor vehicle crash death rate is high, our homicide rate is high, our suicide rate is over the top. And you'll see these numbers. I think for me, that was probably one of the most startling things that when we went through this data, is to see how high our suicide rate is. And then infant death is high too. When we look at cancer as being the second leading cause of death in Mohave County, lung cancer tops the charts and then goes over. Lung cancer is just epidemic here. Breast and cervical, actually, our breast cancer numbers aren't too bad. They're high, but not too bad. Cervical cancer is very high here. And our colon is high, but not totally out of the range. Prostate is relatively low. So if we look at cancer mortality by gender, this pretty well reflects men. More men die of cancer than women. It's always kind of been the case. But you can see that the blue bar, Mohave County, as compared to the red bar, Arizona and the United States, our numbers are still higher than the averages. We're seeing, like I said before, just huge high prevalence of COPD, heart disease, asthma, and diabetes. This indicator is adults who over 18 who self-report having poor fair health, and this was out of the CDC surveillance system. So they do their own surveying, and of those. And you can see that 150,000 people responded, and 20% said that they were in poor health. Poor dental health is, when you read through this report, you will see dental health comes up over and over and over again. We have got a real issue in this county with dental health. Part of the problem is, and I'm kind of jumping ahead, but a lot of people, especially on Medicare doesn't cover dental. And a lot of supplement plans don't cover dental. So you've got a lot of older people with dental problems, but then we're seeing in just kind of behaviors a lot of dental problems. And actually, as far as accessibility of dentists, we have a lot of dentists. Unfortunately, not a lot of people can afford to go to them. So we're seeing huge dental problems, and I know that that's an issue with one of our stakeholders, the director of our emergency department. That was what he just couldn't emphasize enough how much that people are coming to the ER for dental issues. We also looked at the disabled population in the county. We have pretty high incidence of disability. In our survey, we actually asked if you have a disability, and the way we defined it was, I'll have to remember, I think it's 30 or more days where you're unable to do your daily activity or something like that. We had some definition of it. And then we asked people what was their disability. Was it hearing, or was it deafness, blindness? Yes, the survey is, the results of the survey are in the back of that document. But anyway, we did ask, and almost the main majority of people who said they had a disability had some other, we asked some specific things, conditions, and then most of them indicated some other condition that limits movement, I think is what they said. So again, that's another point to be looking at on a county level is what are access and issues for the disabled. This was a very interesting indicator. It reports the percentage of adults age 18 and older who self-report that they receive sufficient social support, that they have people around them that can help them, that they feel like they have the ability to navigate life. And we have, it was interesting, 75%, meaning that 25% of the respondents said they don't have adequate social and emotional support. We looked at and spent a lot of effort looking at behavioral risk factors in our community. We all know that, there are certain things that lead to disease and infirmity and a whole host of other things, mental illness, whatever. So anyway, we looked at different risk factors in the community. We looked at indicators again on a statistical basis, and then also asking for feedback from the community in the surveys. Our behavioral risk factors are, again, very high. Mohave County has one of the highest smoking rates in the nation. We all know that. 28.40 as compared to Arizona, 17.60 smokers in the community. We looked at heavy drinking, binge drinking. 20.10% of our population, this is among adults, and we'll get to youth here in a minute, are heavy drinkers. 25% physically inactive, 80% not consuming enough fruits or vegetables, meaning poor diets, and as a result, 27.9%, almost 28% are obese. Now, and obese is, do you have the 30% BPI? Okay. So these are, obeses are very heavy, not just some that have a few little whatevers. Anyway, we looked at youth concerns too. What we did is we pulled data from the Arizona Youth Survey. This is a survey that's done with high school students, actually 8th, 10th, and 12th graders. It's done every 2 years, and it's done by the Arizona, criminal justice system. I had an echo back here. Thanks. Anyway, and so we pulled data from that survey, which looks at Mohave County students. The numbers are just almost terrifying. The kids that are just drinking and driving, and this is self-reported by these kids. There was quite a large survey field in Mohave County with this last survey, which was done in 2012? Yeah, spring of 2012. And I think there were over 2,000 kids that responded in this survey. So it gives us a pretty good indicator of what's happening with our youth. Oh, it's all right there. And you can look at that in the report. We look at not only alcohol, drug, and tobacco use. We pulled those statistics, and of course this is just a summary of the overall larger report that was done by the criminal justice system. But we also it also looks at bullying, things like that that are affecting our kids, and risk and protective factors. What are the things in their environment, in their home life, whatever, that are putting them at risk? Are they attached to school, for example? Are they involved in activities? Do they some of those kinds of things that are protective factors, and then also risk factors such as their parents give them drugs and alcohol. So there's a lot there. Yes. That was a number that we really tried hard to get, and we were never able to get anything real definitive. And I'm not sure we need to get that number because it's high. We've all heard there's a lot of children living with grandparents, and that just presents a whole other special set of issues, not only for the children but also for the seniors that are trying to take care of them. And yeah, we tried on that number and never found it, I guess. Yeah. Oh, good. Okay.
I'll give you a break.
All right.
And as we move forward with this assessment, there was many things that we left out, like we didn't have.
You need to speak in that.
We didn't have crime data. We left that out. We left grandparents. So as we wrap this up, we'll be asking you to participate as we move forward. And there are things that, as you listen to this and then read over the report, that you see missing. You need to bring that to this process. So I just wanted to back up a little bit on that youth assessment survey. It's done every 2 years, and maybe 3 times ago, so that's 6 years ago, I was at a meeting and they were reporting on this information, and I was looking at it and I said, well, who's feeding into this data? And they looked it up and they said, oh, 2 schools in Bullhead. So those schools were reporting for the whole county. And what? Yes, yeah, and it's based, it used to be attached to funding. So if the school received whatever title it was, they had to participate in this survey, have the kids take the survey. Anyways, long or the short, our team, the Chronic Disease and Tobacco Prevention, contacted the criminal justice and all the schools, districts here in Mohave County, and went and saw them and requested that they participate in the survey. And that 2010 report, there was all but, I think, 2 schools didn't participate. And why I'm telling you this story is because the data is only good as who's feeding into it. And so when you look at this, you have to say, where did that come from? Do I believe what you're telling us? And so just so you know, this group that's working really looks at that stuff. And to add on to that story, we had a really hard time with one of our local schools here to get on board to test their kids because they thought their school, fairly new school, didn't have a problem. Anyways, the kids took it. And that administrator now sits on the board at the governor's office on family and children and youth. So she became active when she saw the picture of her school, her district. So it's exciting. I mean, that's a story to share because then that school took ownership of this process. So currently we're right now with the schools trying to get them on board to take the survey in the spring. So Terry just went through the secondary data, and that's data that's collected through surveillance systems that are ongoing, like the Arizona Vital Stats. We have CDC, we have Monitoring the Future. So all these entities are collecting the data, and it's a really good indicator along with the perceptions of our communities and what's going on. So you need both primary and secondary data to look at what's going on in your community. So I am going to talk about the primary data, and that's when we ask the opinions, attitudes, and perceptions of the community leaders, the residents. And so what happens is you want to make sure that you have the secondary data that mirrors the primary, because you're not going to be able to do anything if they're not working together. And we'll show an example, a funny example of when they don't line up. So again, we interviewed 26 key stakeholders. 40 community stakeholders took a questionnaire, and then the 1756 reported out on the survey. And the key informants told us that these were the issues that they were concerned about. As it related to health and quality of life, they thought that the lack of access to reduced dental and medical care, so there wasn't enough access for those services. And we had issues with mental health here in our county. The underserved populations and the community needs, they thought, again, it was access to medical and dental services. Transportation was a problem. Health and nutrition and lack of available fruits and vegetables. And the uninsured and underinsured default to the ER for services, so it's blocking the ability to get in for emergencies. And the barriers, they thought lack of education and communication with health resources. And we had a lot of unhealthy lifestyles going on, drinking, drugs. And then most important health and quality of life issues were low-cost providers and the lack of education. And then our stakeholders, same kind of type of questions. When asked about the health of their community, they thought 90% said, oh, our communities are somewhat healthy to very unhealthy. And then the 3 factors for a healthy community, they thought it would be good jobs, a healthy economy, and the access to quality health services, and then healthy behaviors and lifestyles. And the 3 most important health problems were drug addiction, our aging population, and mental health problems. So you can see the key people are mimicking the community stakeholders, and our data is showing these same things too. This was the funny thing, the community survey findings, the personal health, they thought 72% were healthy and very healthy. So they thought that their health, their own personal health, they were pretty healthy.
Can we ask questions?
Mm-hmm. Yep.
3 most important health problems: drug addiction, aging problems, and mental health problems. Mirroring the data.
When we showed one of the slides, it showed that we had lacking emotional and mental support systems. And when we, I don't know what slide it was, and it's in your indicator, but mental health is an indicator of drug use. They're probably using drugs because they have mental health issues and they're self-medicating. Mm-hmm. So
but what I'm getting at is the hard data that you were talking about, the specific problems that were causing morbidity and mortality were actually more lifestyle related in the area of smoking and chronic obesity, causing cardiac problems and lung problems, i.e. the #1 cancer cause of death in Mohave County is lung cancer, which certainly doesn't mirror this.
Why do people smoke? A lot of them are smoking to self-medicate.
I seriously doubt that. Most of them are smoking because they became addicted when they were younger and they can't stop.
Right. Well, whatever the case that they start, the #1 reason that if somebody quits and then starts back, it's stress-related. That is the #1 reason why somebody, after they quit, they go back. I mean, their body is, of course, addicted to the nicotine, but it's stress. What? Yeah, this is the primary. This is how they reported. But what I had said was that when they say these are the issues, we have the data to prove that. That's what I was saying.
And there again, I hate to be arguing
No, that's fine. This is good. It is.
So that's actually not a valid.
But stress relates to like cancer and all of those. It's an indicator in it happening. And all I'm saying is we have to look at everything too.
I think you can't simplify it down to stress, though. You can't simplify it into the bucket of stress.
No.
Because there are so many other factors that contribute to, you know, the data that was shown, and this doesn't mirror the data.
Well,
So,
I think one thing, though, is that this is what the stakeholders are seeing as issues, what their perception of.
right, understand that, but it doesn't mirror the data.
Right, right, in some cases.
However,
If you drill down, I mean, to me, that suicide stat is a major indicator of mental health issues in the community.
right.
But I want the hard data on this, and the suicide stat. How many people? What was the overall percentage of suicides in Mohave County as compared to the population? 0.01% of the population. 0.001. What would you say that is? I know we don't have that.
Is it in the report?
Yeah.
Can you look it up?
Yeah.
This is an example of
Right.
This is an example of something, though, that we can, if this is something that the Board of Health deems as important, then it's something that we can, as a group or as the health department, assist in digging down into that data to actually find out what is going on with why our suicide rate is so high. Come back with a report to you specifically on that, and then see if we want to do if there's anything we can do to address that that's separate from some of this other stuff. But this is what the community stakeholders thought were the issues,
Right.
even before they saw the data. So it doesn't mirror the data.
So I might have used the wrong terminology. Let me say this. For example, the drug addiction. The community stakeholders thought drug addiction was an issue. Well, if you look in the report, we have really high rates of people entering the ER for substance abuse problems. Okay, so if they think that their perception is we have a drug problem, and then we have the raw data from the emergency room stating that that is true, then we can move forward. The stakeholders will take ownership of this issue, and then as a community, we can do something about it. How can we fix this, or how can we improve? Right.
But we're number one on everything.
Right.
And you know, while I personally think that the drug addiction portion is very important, and I see a huge amount of drug use in the high schools down in the whole county. In fact, we were discussing the fact that in a 2009 study, Mohave County was the #1 county in the state for prescription drug abuse among high school students. So yeah, that is very huge.
Yeah.
But you know, I just see from the hard data that you've presented, which is awesome. You guys have done a wonderful job on this. But from what I see on the hard data is that we have people getting really, really sick and dying from things that are not specific to some of the stuff that what seems to be the community stakeholders' perceptions, which, you know, that's okay. We can talk about their perceptions, but the actuality and what seems to me to be, and I'm going to have to read this more in depth in the 20 minutes that I took on this, is that there is, you know, a significant amount of work that we need to do I was sitting here saying that the drug abuse was huge just a little while ago, but I see that there are some other areas that are actually more important and need to be addressed.
Right. And we can't address it all. So,
Sure.
and this is the first time that this is being done. And so you bring up really valid points, but we are trying to have each community take ownership. We have this info. We've looked at different entities to find their perceptions. And as a community, they have identified what they're going to look at, and we'll move forward, and you'll see that.
And I don't know how to use my microphone.
But again, like, they chose aging population, and we have that information to prove that. So, I mean, that they're looking at, we're going to have to provide services down the road for the elderly. Do we have things in place to support when they become disabled? Are they healthy as they move into their older years? So that's all that I was trying to say is have.
I think we got just to, along with this, I know we had kind of a discussion. A reporter asked the CEO of our hospital when this report came out if he was surprised by any of the findings in this report. And he stated that he was surprised that the community didn't see cardiovascular disease as one of the big issues, because it is the leading cause of death in the community, as it is throughout the world. But and man, it was like it created this firestorm in the paper of people going, well, the drug abuse problem, that is a really big perception. And I think it's important that we look at, because what the community's perceptions are versus what the data shows are also a whole other thing, because we may need, it may be an indicator of where education needs to be going on. So.
Right, and this is the time for the survey, community survey findings. The general health of the community, they thought 77% were somewhat healthy to very healthy. And then those community stakeholders believed that too. So very unhealthy. So while they thought their personal health, they were very healthy, they thought their communities were unhealthy.
I'm not too good at that either. I was just wondering on the suicides if it was broken down by ages, because I'm thinking some of our elderly who get to that time in their life and, you know,
Right.
could be part of the suicide.
Right.
You know, and then I hate to say that we're seeing more and more in our young people of
Right.
younger,
Right.
even middle school and like that area too.
And as we move forward with what some of the communities are doing, we are looking at the prescription drug. We're actually working with the state on the prescription drug initiative statewide. And there was a man that came to one of our community groups that we had, and he came with pain management as a sufferer of pain. And what he said is if there's no drugs to be had, they go to the street to get the drugs, because they need it for their pain, and then they get to the point where they can't get it, and then they commit suicide. And I hadn't thought of that until he expressed that in the group. So I'm just saying that's another population.
And it could also be our military veterans too,
Yes.
with PTSD
Yeah.
and everything.
Yeah, and I think, I'm not sure we have it in the report, but on the Arizona Vital Stats, it does break it down by age. Yeah. And then the community stakeholders thought the most important health problems were drug addiction, mental health, and the aging population, like we saw. And the community members thought drug addiction, the aging population, and alcoholism. And they thought these were the barriers to health care. The community stakeholders, the economic conditions, lack of health insurance, lack of affordable health insurance, and the low literacy and education levels. The community members mimicked it to just varying with the little percentage points. And again, the disability, there was various things they could choose from, but the highest percent was other conditions restricting their limits to walking, reaching, and lifting. And again, you can see the emotional, mental conditions. And we had this in it. This was telling that their percentage of our community that do volunteer. So 29% of the community surveyors volunteered 1 to 5 hours, 12% 6 to 10. So they are engaged in their community. So. And this we just put up here so that you can see these were the zip codes. This is how we grouped in that report. Kingman, Bullhead City, Lake Havasu City, and then those are the zip codes for the outlying communities. And just the overall findings, the strengths were we had an excellent environmental quality, our clean air and clean water. We had lots of recreational things to do in our community. Community services were dedicated to the health and well-being of the residents. And we had a strong commitment to the community. The weaknesses, poor economic conditions, unhealthy behaviors and attitudes, restricted access to primary health care services, and restricted access to mental health and substance abuse services. And we have a local MSTEP, which is Mohave Substance Treatment Education and Prevention Partnership, that is actually working on getting a residential substance abuse treatment program here. Yeah, I think just, yeah. So then we went on to hold meetings to get the community profiles. We held 3 meetings in each one of them. We presented this information, and the priority health concerns were identified by the community members. And if they weren't there at the meeting, they had an ability to, look at the minutes and then comment and give their vote. So I'm going to let you talk about the next.
Okay, so when Susan was talking about those meetings, what we did is essentially the presentation we just gave you, we gave in each community. And if you look at the very front of the very first page on that report, you'll see the number of organizations that have been involved in this effort. When we talk about involving the community, we really did try to get the whole spectrum of folks that are either providing services or working in the community in one way or another, as well as representation from different age groups, the Indian tribes, whatever. So we did do a pretty big effort in trying to involve these folks. And when we gave them this presentation, what we did, our next goal was to prioritize what each community saw as the issues, the top priority issues in their community. We went through quite a process, prioritization process, on how to how are we going to take all these major, huge, gigantic problems and work on them as a community? Where do we go from here? What we did is we asked each community, hold on, I just got to see what the, I'll just go to, we asked everyone in these meetings, so we held these meetings, we asked everyone in these meetings as we went through this presentation, we gave them a worksheet to mark the things that they felt were of most concern to them, the health categories. From there, we listed all the categories on sheets on the room, around the room, and asked them first to vote, and they were given stickies, and like 5 stickies or something, to vote for the issues that they felt were most concerned. The second thing we asked them is this something that we can address in the community? are there resources in our community that we can address this issue? We didn't want it so broad and that it's everybody else's issue, not ours. So we established some ownership with the stakeholders. And so, again, they put stickies on those issues that they had resources within their organization to address. Secondly, we asked them to, if they're aware of any other organizations within the communities, to put stickies within the community that can address that issue, and to list them on the sticky and put them on. So we had a picture of all these issues. We had a picture of what people really saw were a concern in their community, but then were there resources in the community to deal with it. And from there, then they voted on what they felt on a final vote of the top 3 issues within their community that they wanted to address. So with that, Bullhead City, the top 3 issues that were chosen were accessible, affordable health care, mental health, and substance abuse were the 3 issues in Bullhead City chosen by that group with that process. From there, we have built teams, and through that process, of course, we identified resources that could address that issue, and so we're building teams within Bullhead for each one of those issues. So we'll have a task force on accessible, affordable health care. We'll have a task force on mental health and one on substance abuse that we're currently building in Bullhead City. And we have names identified, and we're kind of in the process of putting those together. Kingman, chose, and much my personal surprise, improving economic conditions. They really, and I was really surprised at the resources. I mean, I thought, oh man, that's so out of our control. How are we going to, address that as a health issue? However, the group chose it, and with that, my boss, Jamie Taylor, is now the president of the Chamber of Commerce and is working on that. She is putting and has put a group together. We're bringing she is bringing a lot of folks to the table that haven't really been to the table before to look at how do we improve and real strategic planning on how to improve the economy, jobs, whatever. Again, to me, that seems so unreachable, but there's some real progress being made. And I need to back up. Our goal in doing this community health improvement plan is we want to choose almost some low-lying fruit to have some success with this process. So we're asking, what are some things within these categories that we can really do to have some success? And part of this plan, this is not a thing that we go and we do this fancy report and everybody goes off into their corners and things go on as usual. That is not how we want to do this process. This process is about setting concrete goals and measurable goals. And how are we going to achieve them? We really are wanting to set goals. People are owning them. Again, we have this just amazing collaboration going on between all these different entities. Folks are seeing that maybe we can make some positive change. We're not going to change the world, but if we can pick a few issues within each of these categories to address and have some success, hey, it's progress. And then in 3 years, as we go through this and we all get a little bit better at it, then who knows how much more we can do. So anyway, we do have that committee that's being led by the Kingman Chamber of Commerce that are really tackling the economic conditions right now, and their goals and strategies will go into our health improvement plan. The second issue that was chosen, The second issue was substance abuse, and it is not showing on this slide. So, again, we're deferring and we're trying to use resources in the community. We are not wanting to reinvent the wheel or try a new initiative. We're building on things that are already going on. Of course, MSTEP has made amazing progress in addressing substance abuse issues in our community. They just recently were approved to build a residential treatment center. That is something that's huge here, to have a residential treatment center in Mohave County, where family can be there to, their goals and some of their strategies as far as addressing some of the mental health issues will be in our report. And then in addition, as Susan mentioned, we have started working with the state as far as the RX initiative. This initiative is, there are national goals, but statewide goals, and certainly looking at Mohave County, we have one of the biggest prescription drug abuse problems in the country, really, and the resulting issues from that. And they have very concrete strategies and goals, things like educating primary care providers on prescribing opiates and addictive drugs, and everything from working with pharmacists and safety nets on catching those, and just community education on what's going on with our kids stealing grandma and grandpa's drugs out of their medicine cabinet. So it's a very big initiative. They, as Susan alluded to, they did presentations in all 3 cities, and we have a lot of folks really stepping up on board on that. So that's 2 of the ways we're going to be addressing the mental health issue. The third issue is youth risk and protective factors. Again, this was as a result, Keeman saw this as a huge area of need. The Mohave County Probation Office has started a work group. It's been in existence now for about 2 years. I sit on that work group, the Mohave Mental Health. There's several, my brain's going blank here, but most everybody, plus the schools, a lot of folks that are dealing with youth in the committee sit on this, or youth in the community sit on this committee. And so, I was trying to say Arizona Youth Partnership. But anyway, we sat with that committee. We decided we would do an advisory role, and we went through the same process on that committee where we looked at what are the youth risk and protective factors. And so we kind of went through the same process of identifying priorities based on what they're seeing, what the schools are seeing, what the folks that are dealing with these kids, certainly probation office, whatever, what are the issues that they're really seeing. So we dove down another level and identified the 3 top risk factors that we're seeing happening in our community here in Kingman. And it was really interesting because what came out of that is we have a lot of kids, and I don't quote me on the numbers, but it's a really high percentage of our kids being suspended from school for just there's a no tolerance policy in our schools. If a kid has an alcohol drug problem or comes to school high or drunk, they're suspended. The problem is nothing's happening with them afterwards. They're going home, they're playing their video games, they're doing whatever, and then it's just a huge downward spiral. So we've seen a real issue with kids being suspended from school and no safety net for them from there. And that number It'd be interesting. We're trying to pull data on that, but that number could be be contributing to our 4-year graduation rate and why that's so low. So we need to pull some more data to look at that. Second risk factor is that we've got a lot of parent attitudes that are favorable to antisocial behavior. How we're going to address that, I'm not sure, and then the third one was family conflict. And again, these were 3 things that those that are working with youth felt they had resources to deal with. We went through that same process in identifying those 3 issues. So we're in the process of making recommendations on those 3 issues with that group that we'll give to the bigger group that was identified in the initial stakeholder meeting. So that's probably the one that we're making the most progress on right now. Oh, there's the substance abuse. Okay, like Havasu, we've identified the three top priorities in Lake Havasu. Again, was accessible, affordable health care, mental health, and youth risk and protective factors. Probably the mental health and youth risk and protective factors will fold into kind of what we're doing in Kingman and expand that. And again, the accessible, affordable health care. However, we will be and are in the process of setting up subcommittees for each one of those areas, and have the people and names that have volunteered, just haven't gotten that far yet. So that's where we're at with that. And Susan?
We're almost wrapping it up.
Yep. One more slide, 2 more slides.
This is huge, what we're trying to accomplish here, and how do we maintain keeping everybody informed? Because we do have Lake Havasu calling us, when are we going to start? So they are engaged. So we make it our job to keep everybody informed. And over the holidays are coming, so in that time we are going to develop a website that is for this health initiative. It will have the profile, it will have the improvement plan, it'll have the timelines, the mission and goals. It's going to have the mission and goals of each one of those subgroup work groups for each community, so that they can log on and see what's going on and when the meetings are. So that's our way of managing the information and easy accessibility to those that are part of this process. And any comments, suggestions about this process, feel free to contact Terry or myself. And with that, Patty is going to come up and talk about what we need from you.
It's kind of overwhelming for you to see this and hear all of this and look at that, look at the data, and then see what the community groups picked to work on and try to figure out how you can put all this together for public health in this county. So I'm hoping that you will, this is just giving you an incentive to go home and spend some time between now and our next meeting looking at this and thinking about what kinds of things that the Board of Health and that this department needs to get really involved in, other than what you see here. We are hoping that you'll become an active participant in some of these community work groups. We haven't had a large presence with the Board of Health in this county in the past, and we're always trying to change that. I know Margaret tried on her previous role in the Board of Health, and we're really glad she's back. Kathy Bruck, we've had members of the Board of Health that have really tried to become more active in the community and let people know that we do have a Board of Health and that they're active in their community. So we're hoping that you'll do that. I would really hope that you would go back to the Board of Supervisor that appointed you to this position and spend time talking to them on a regular basis about what we talk about here, and also about what public health is doing and how can we get that message out there. If there's specific things that you feel like as a Board of Health you would like to focus on out of this health assessment, I would hope that you would have conversations with me or with members of my team. We're really interested in improving the health of Mohave County. And some of that may involve policies at some point, policies that you think would help improve the health of Mohave County. And if you think those kinds of things are important, we would hope that we would discuss it here, and then you would be able to support us as we moved forward with that to the Board of Supervisors. Even simple policy recommendations that deal with school districts, other things like that. And then one other thing, I would hope that you would let your city councils know. I know some of you are city council members, but cities don't have health departments in Arizona. So the health department is the health department for the county as a whole in each community. And we have no official way, per se, of getting this information to our city councils, and we want feedback. We want to know what our local elected government officials need and expect from local public health. So we're hoping that you'll get involved with that. I just wanted to report back to you. Last time Rachel gave a presentation on environmental health, we had each division talk about some of their services, and Rachel mentioned some food code meetings that some of you mentioned an interest in attending. We did send that information out to you in email last week, and we had our first meeting today in Bullhead City. And Rachel and I were concerned we might not have anybody even there. We had standing room only. There was huge interest on the community of the restaurateurs and business owners in Bullhead City to participate in looking at what the new food code would involve. We have our meeting in Havasu tomorrow, and we have our meeting in Kingman on Monday. So we're hoping that we can report back to you what the food code would look like, and then eventually, hopefully in January, that will happen. We'll present that to you, and you'll be able to hopefully adopt that as the Board of Health, so that you can give your blessings to the Board of Supervisors to say that you're in agreement with that.
Excuse me.
Yeah.
We actually I didn't get an email about those food code meetings.
Okay, we sent them out last week. To
They
your
did
email
come.
addresses.
They did come. I went to the one in Bullhead today.
Yeah, I didn't get it. I just checked my email again, and I didn't receive that.
Okay,
So I don't know what I got the one about this meeting, but I didn't get anything about the food code meetings. So
I don't know what happened, but we used the same email list, so something happened, maybe spam or something. I really don't know how to answer that one. We used the same email list. I'm sorry for that, but I'm not sure what happened. We do have a list of the proposed meeting dates for 2014, if you'd like to write these down. I didn't include them on your minutes. These are tentative, but it gives you an idea. Hopefully you can look at your calendars for next year and pencil these in and see if any of them are glaring problems for you. We're looking at January 15, April 16, July 16, and October 8. Those are all Wednesday nights, as you said you would prefer. Also, I just wanted to make sure that you know that if there's anything of interest regards health in the community that you're interested in hearing about from the county and you want a meeting on that, please let me know and we can plan for that in the future. And just as an example, if you're interested in the chromium spill in the Topak area, if you don't know anything about that, but you'd like somebody to come and talk about that, that's something we can bring to the Board of Health, those kinds of issues. So just email me or call me up and I'll be happy to talk with any of you about those kinds of things. But we're tentatively planning right now in January to have our meeting be on the proposed new food code. Yeah, Margaret.
Yeah, but I was just going to say, I think it would be, I'd like to hear the chromium thing again to see how they've changed their story since the,
Okay.
7 years ago or whatever it was that they gave it, because I've heard things or you hear both sides type stuff. And I think out of, these are all great things and these are very important things. But if that goes,
Sure. We will try to line those up perhaps for April.
Okay.
And again, if there's any other issues you want addressed, please let me know. Thank you.
For the cities, a brief presentation on this to the city councils?
Sure, if we can get an audience, we'd be happy to do that. Then I would need some support from you guys to contact City Council to say that you think they need to hear this, and I know it's probably easy for Kathy to do that, but I might need some help here in Kingman and in Havasu.
That's no problem. One thing too is in Havasu we have our own TV station now, or channel, and if you could do some type of a program that we could put on there, I know that they would play it for you.
Sure.
And Bullhead.
Yeah.
You mean a presentation on this that's already taped?
Yeah.
Okay. Well, this is being taped. They can always use this to put on their program. It may be too long, but Susan is getting ready to put a short presentation on for Seroptimus and Rotary. So I'm sure, and I think Terry's done some shorter presentations of this, so we can perhaps put together a 15, 20-minute synopsis of this and then have that available to take out. So just let us know. We're happy to help in any way we can. We think this is important information. And yeah.
It was Rotary and all those service clubs that took the survey too, so we're giving them back their info.
Okay. Did you hear that? That many members that took the survey were Rotary members and Seroptimus, so they're going to hear back what they. It is interesting to note that the problems that the communities pick to work on are not what the data shows are the problems.
One thing I'd like to see is how many health classes are being taught at any of our school districts, because they're not. Because it's not being, it's not a priority because it's not on a test, so they're not doing it. And I think it's a great waste not having it. And there should be a health class at middle school and high school at least.
Well, we do have a group that meets with the schools now regularly, right? And, right. So I think some of those issues are planning on being discussed in the future. And Christy's doing an interesting project. I hope she can report back at one of our future meetings. She's doing an immunization record study of every child in every one of our school districts because we have such a high exemption rate. People are signing forms to not get their kids vaccinated. And some of it is a true belief that they think vaccinations are damaging. But for the most part, it's a convenience thing. I didn't have time to take my kid to get their shot. So we're doing a comprehensive look at immunization records, and we're finding some very interesting things. We have a very high exemption rate so far, so we've got some work to do in terms of vaccinations.
And also this, I always found very interesting was your reports on the sicknesses that was going through the county. You know, the absent rates, I mean,
Communicable disease updates?
Yes.
Would you like those in the future meetings? Okie doke, we'll do that. We can easily do that.
And just for your information, we didn't cover it in the presentation, but again, there is information on here about communicable disease and some statistics from the health department.
We have a very high rate of pertussis right now in this county. We skyrocketed the stats for this last year, but that's because we have quite a few cases up in the Colorado City area, northern part of the district, but we're double the rate of anywhere else in the state.
Well, that answers my question that I had. If we have a high rate of people who choose not to have their children immunized, then are we seeing a increased rate of preventable
Yes, we
disease?
are. Yes, we are. And the unfortunate part about that is what people, I don't know if we've gotten so far from the time when some of us were young and there were some diseases that were rampant still, but you know, a lot of these younger parents don't know how damaging some of this can be when you don't have that herd effect from everybody being immunized, and all it takes is, you know, a bunch of kids in a school being unprotected and you've got a big problem. So we're going to have to work on that. But Christy's going to come back at some point with a report on what those rates are and what she's found and how we can improve those vaccination completion rates.
Patty, one also thing I think would be very good, because I'm surprised by people I come in contact with and tell about the health department. that it is in the cities and that there is a nurse and that they can go and see. They just don't realize that it's being offered out there. And being away from it now for a while, I don't know what still is being offered.
That's very interesting that you brought that up. We have spent 10 years doing a public media campaign. If you remember, I used to be on the radio all the time talking about what public health does. We had brochures. We did just about everything we could think of to educate people about what's public health. And I just had a conversation with a member of Christie's staff last week who tells me that nobody's ever heard of us, especially she lives in Golden Valley, and she said she tells them where they work, and they're like, what's that? What do they do there? She said, well, we can give your kids shots. Really? They had no idea we were here. So we're looking at actually working with her. She's contacting all the mavericks in the area out there, those kinds of places, to see if they'd be willing to put brochures up that actually tell people you can come to the health department for these kinds of services, because apparently no matter what we do, people don't understand that the health department is there, especially as a safety net for people who need help. So
what was it, Nurse Betty?
Dixie. Nurse Dixie.
Oh, yeah.
You used to call her Nurse Betty.
I know, I
her
still
name
can't
is
get
Nurse
it right.
Dixie.
But that was, well, you couldn't get her name right, but that was a great thing, because I remember being on the radio.
Maybe we can start doing some of those again. The problem is most of the time that costs a lot of money, which we don't have that funding anymore for that. That's the problem.
Well, I can tell you one radio station that will give you 30-second spots for nothing.
All right, we need your help. As you can see, we need help in getting the word out there about public health and how to improve our community's health on a lot of issues. So we're really looking forward to working in a partnership with you. Thank you.
I'd like to extend the board's thanks to both of you. It was an excellent presentation and something of an eye-opener. And we will all go home and, I guess, do our homework and read this report through in detail. Let's see. Now, I guess the next item is the call to the public. There being no public.
Be thankful.
Okay. And do I have then? Are there any other?
Nope.
Oh, you're getting
I'm
ready.
waiting.
Is there a motion to adjourn?
Yes, I move we adjourn.
Second. Second.
Okay. We are adjourned then.